working on the client's lower extremities. This client expressed she's been riding her bicycle quite a few miles, just did 30 miles or 40 miles yesterday. Her legs are very sore and tired and stiff, and they need some TLC. So I'm going to start in working adductors into the quads, going more broad. Then I'm going to get a little more specific, coming down to the lower leg, working the tibialis anterior, brace thumbs, coming out all the way up, a little bit of palm spreading on the peroneals. I'm going to invert the foot and bring it down, get a nice little stretch so I can get that lateral side a little bit better with the flat parts of my fingers. As she's expressed the stiffness and tightness that she's got going on, I'm going to incorporate the Hypervolt 2 massage percussion gun. I find it to really enhance everything that I'm doing in the massage session. So even being on her feet in her everyday activities, the bottom of her feet are sore as well. This particular top has the head that's more of the specific, and it can go right on the skin. I'm going to hit the bottom of the foot, being more broad. And I'm going to come up, I'm not going to hit the medial portion of the lower leg, but I'm going to come into the lateral portion. I'm controlling it. Does that feel okay?
Feels great.
Working that tight tibialis anterior, working the peroneal muscles. I'm going to continue right into the vastus lateralis. Going medial of the thigh, the quad. Now the inner thigh might be a little more tender, so we won't use that there. I'm going to continue with my massage. What I'm going to do next is some stretching of this hip joint, where a lot of the muscles, anterior and posterior of the leg, attach. So my first range of motion, I'm going to go underneath the knee, support the knee, lift the leg, and just bring her knee to her armpit. You okay?
Mm-hmm.
Getting a good stretch and bringing it back. And one more time. She complained that her hamstrings are more tight than any other area, so we're going to address those in a minute. I'm going to go laterally. I'm going to support the hip. The stretch here, I'm not going straight across. I'm actually bringing it up and over. And as I exhale, I'm going to go up and over. You okay?
Mm-hmm.
Checking in with the client periodically, making sure that they're in a comfortable zone. I'm going to move to my forearm and do a stretch down the IT band into that glute. She's completely draped. I actually have her holding onto the sheet here. I'm going to open her up and stretch that hip joint a little bit more. You okay?
Yes.
Not uncomfortable at all?
No.
So her foot is resting on my hip. I'm just leaning forward with my legs, but supporting her legs. The next one I'm going to do is a straight leg hamstring stretch. So I'm going to support the knee and the ankle, and I'm going to go straight up. I'm going to elongate and the knee towards the armpit. And this is where, depending on the client, I would say, tell me when.
When?
So here's her end feel, here's her tightness. I can feel it right here. What I want to do here, I'm going to bring her back down for a minute. Bend your knee and just hold tight. I'm going to use Stopain Clinical. It's a topical analgesic. I'm going to rub my hands together. And while she's here, I'm going to come up underneath and work on her hamstring while she's up. So I am going from distal to proximal on the hamstring, allowing that product to get in. And I'm going to do another hamstring stretch. Let's see if that cooling sensation helped a little bit more. Good?
Yes.
So with this product on her hamstring, I would like to use the Hypervolt 2 again, except right here on this hamstring. With the push of a button, I'm going to apply it to the hamstring. Is that too much?
It's tolerable.
Okay. The percussion of the massage gun allows that tightness in that hamstring to loosen up a little bit more, making my job a little bit easier. I'm going to support the knee with my arm, setting her foot down and stretching, getting that hip joint opened up, working the iliopsoas, giving that a nice, easy, gentle stretch. Bringing her back down, palms spreading. So now I've got product on my hand from working the hamstring, so it's still affecting other parts of the leg as well. The topical analgesic of Stopain Clinical is very safe. There's no parabens, no fragrances, no dyes. It's good for your skin. Do a little jostling. Everything's loosened up. How does that hamstring feel?
Great. Thank you. Feels much looser.
Good. And I'm going to end with a little bit of traction. Slow and controlled. And then I'm going to release it.